Hello everyone, my name is Leslie Griffiel, and today I'm going to do a Pekakucha presentation of the benefits of whole grain diet in the management and prevention of type 2 diabetes. This presentation is for my assignment 3 for the PIDP 3240 course that I'm currently undertaking, which is the Media Enhanced Learning. Type 2 diabetes mellitus is a metabolic disorder of fuel homeostasis characterized by hyperglycemia and altered lipid metabolism caused by islet beta cells being unable to secrete adequate insulin. A wide variety of lifestyle factors are also of great importance to the development of type 2 diabetes, such as sedentary lifestyle, physical inactivity, smoking, and alcohol consumption. Studies have shown that obesity is the most important risk factor for type 2 diabetes, which may influence the development of insulin resistance and disease progression. Glycated hemoglobin, or HbA1c, has been recommended by the World Health Organization for the diagnosis of diabetes. Glucose in the blood binds irreversibly to a specific part of the hemoglobin in red blood cells, forming hemoglobin A1c. The higher the glucose, the higher the hemoglobin A1c. Hemoglobin A1c circulates for the lifespan of the red blood cell, so reflects the prevailing blood glucose levels over the preceding 2 to 3 months. According to Golub et al. In 2017, hemoglobin A1c is the best indicator to monitor diabetes because it is least affected by any short-term illness, related changes in plasma glucose levels, and the test can be done in a non-fasting state. The National Institute for Health and Care Excellence 2015 advises on healthy, balanced eating to patients with type 2 diabetes mellitus by encouraging high fiber, low glycemic index sources of carbohydrates in the diet, such as fruits, vegetables, whole grains, low-fat dairy products, and oily fish, and control the intake of foods containing saturated and trans fatty acids. Whole grain foods are found in cereals such as wheat, oats, barley, maize, rye, and brown rice. The grain is made up of 3 constituent parts. The germ is the reproductive part of the grain and is packed with nutrients. The endosperm, which is the starchy part, accounts for about 80% of the grain, and the bran, which is the fiber-rich outside shell of the grain. Incorporating whole grain in the diet has been strongly linked to the prevention of type 2 diabetes and in maintaining good hemoglobin A1c levels. Lammert et al. 2007. When compared with consumption of refined grain foods, whole grains result in lower insulinemic and glycemic responses. The major difference between whole and refined grains is the preservation of the bran and germ in the whole grains. Fiber is particularly concentrated in the bran fraction. If consumed in substantial amounts, viscous fiber, such as the glucan found in oat bran, delays gastric emptying, thus exerting less insulin demand on the pancreatic beta cells. Zhong et al. 2015. Foods higher in fiber can reduce postprandial insulin response, and a diet higher in fiber may improve insulin sensitivity and lower insulin secretion. Hodge et al. 2004. In the study conducted by On et al. 2013, it was revealed that high intake of whole grains but not refined grains is associated with reduced type 2 diabetes mellitus. High whole grain intake has been associated with greater insulin sensitivity and lower fasting insulin concentration. Second, greater intake of soluble fiber reduces the rate of gastric emptying and leads to slower blood glucose and insulin response. And lastly, high intake of whole grains may reduce type 2 diabetes by reducing concentrations of inflammatory markers and has been associated with greater blood concentrations of adiponectin, a cytokine that increases insulin sensitivity and reduces inflammation. In the pilot study of Lammert et al. 2007 about the clinical benefit of short-term dietary oatmeal intervention in patients with type 2 diabetes, it was found out that consecutive treatment with oatmeal for 2 days significantly reduced the insulin dosage needed by 42.5% and was also associated with a significant improvement of blood glucose levels and a reduction of hemoglobin A1C from 8.6% to 8.2%. In the study of Malin et al. 2017, it was also concluded that whole grains reduce diabetes risk by reduced postprandial blood glucose and peripheral insulin resistance that were statistically linked to enhanced metabolic flexibility. In Malin's study et al. 2017, when comparing whole grain diet to refined grain diet, there is a reduction of 1.9% loss of fat mass in whole grain, whereas 0.2% loss in refined grain diet. This supports the hypothesis that the whole grain diet has benefits. The application of the research findings of whole grain diet can significantly improve the care and service that can be provided to the patients who are high risk for developing type 2 diabetes mellitus. As a nurse, preventing hospital readmission of patients with long-term health conditions through health promotion and education is key. This involves empowering patients with knowledge and skills in preventing diseases and by managing long-term medical conditions such as diabetes. The promotion of whole grain in the diet of patients who have diabetes or at risk of developing diabetes can reduce the morbidity rate, improve quality of life, and has cost-effective benefits. To conclude, whole grain can improve in the management of type 2 diabetes, and it has been associated in the reduction of hemoglobin A1C levels, resulting in good control levels. This is the end of my presentation. Thank you for listening and have a good day.